Stoked to be the Stokes, and I'm here with some more information about women's health. Now, as a labor and delivery nurse and a new mom, one of the questions that I get most often from friends and sometimes strangers is, how do I choose an OB? How do I choose the right hospital? So I wanted to just go over a few different tips that I feel like were very helpful for me and people that I know, okay? So first of all, when choosing an OB, go not only by Yelp reviews, but also word of mouth. One thing I caution about reading reviews is that a lot of people who write reviews are writing them because they're disgruntled. But if you go by word of mouth, people in the community, you're more likely to get a more accurate account of a personal experience. Now, I know that one of the main things that I want to know when I'm seeing an OB or referring a friend to an OB is how comfortable they are with the setup of that OB's practice. So one of the main questions to ask is, do you practice within a group or as an individual or solo practice? Now there's pros and cons to both. With the group practice, there's a chance that your favorite OB or provider or midwife might not be the one who's delivering you. Likely you're going to get to meet each of those providers that work within the practice throughout your time being pregnant. So each visit you might see someone different. Likely you're going to have a favorite and maybe a not so favorite person. So it's pretty good to ask ahead of time, what is the rotation schedule like? How likely is it that I will have you as my OB, okay? And also make sure that you feel comfortable talking to each of them, which we'll get into in a second, communication. Secondly, one of the things about a solo practice that I have found to be on the better side is that you are likely to get that doctor for your delivery. However, in the event that they are tied up at another hospital, maybe in another delivery in the same hospital or on vacation, you want to know if they have what's called a backup laborist, meaning another OB provider who they've entrusted with their patients to jump in and handle anything. Now, another thing about having a backup OB is that sometimes the backup isn't there. So we're going to get to that with the hospital affiliation. One question to ask an OB is, what hospitals in the area are you affiliated with? It's possible that they might have rights to practice at multiple hospitals, in which case you want to do some hospital visits, ask some questions, and see which hospital you're most comfortable delivering at, okay? So one of the things that I like to ask when looking at hospitals and the different facts about them is, do you guys have an on-call laborist? An on-call laborist or 24-hour laborist is basically another obstetrician who is in-house 24/7 in the event that a patient's provider is not there to make their delivery. So that means that if your doctor is stuck in traffic or in the next room delivering a patient, someone who is able to deliver your baby other than one of the nurses, which of course we are, but that's not what we prefer, is going to be able to come into the room and be your provider for that moment until your doctor arrives or for the whole delivery. Now, one of the other things that we would like to ask is whether or not the hospital is equipped for high-risk deliveries or high-risk care of your newborn infant. So what do those questions look like? Well, I like to know how many births per month or per year, and then you can figure out per month, does that hospital have on average. That gives you an idea of how busy they are. Usually if a hospital is very busy, they're more likely to be high risk or equipped for high risk. Another thing to look at is the level of NICU. Now, NICU is split into four technically different levels. The first one being a well baby nursery or level 1. The second, level 2, being a special care nursery. The third, which most often you hear, NICU, level 3. And then there's also what's called a regional NICU, right? Which is like the NICU for the region. Think of it like a trauma center for babies. That's level 4. So it's important to understand that most high risk hospitals will have a NICU that is pretty much appropriate for the high-risk mothers that they would have there, okay? Another question to ask about where the doctor practices is if they have a 24/7 anesthesiologist. This is important because in the middle of the night, if you're wanting an epidural or if you have a crash C-section, God forbid, you're gonna wanna know that the anesthesiologist is not going to be miles away, potentially stuck in traffic or in the snow, depending on where you live, okay? So those are things that I like to ask when looking at hospitals. So getting back to looking at the doctors. When you're looking at the doctors, for me, I'm huge on communication. I want to know, can I trust you to communicate with me in a way where I feel respected and heard? So what does that look like? Well, I like to do some tester questions first. I want to ask questions about things that I've read for a couple of reasons. One, I want to know, how do you feel about the fact that I've been doing my own research? Does that bother you, or are you encouraged that I know how to advocate for myself and look into things? Two, I want to know if you're going to be honest about how you practice. So let's say it's my first baby and I want to know how you feel about VBACs. VBACs is a term for having a vaginal birth after having a cesarean. Even if you've never had a cesarean, hearing the doctor respond about how they feel about VBACs kind of gives you an idea about how they practice in general. Some are trained to do VBACs, some not so much. Some are comfortable with it and others not so much. So that's a good question to ask. Ideally, you want to have the same doctor throughout all of your children's births. So Not knowing what kind of birth your first one will be will help you prepare to say, hey, if I happen to have a C-section, will that mean that I have to have a C-section with all of my births if I stay with this doctor? That's a great question to ask. Another thing that I like to ask is, how do you feel about interventions? So maybe you can ask about different medications that you've heard of, Pitocin, Cytotec, Cervidil, and you can get the doctor's opinion on those things. Now we're listening for two things. One, information, but two, how it's relayed. I've seen some doctors who will say, oh, don't worry about that. When we get to it, it'll be fine. They're all not as bad as what you've read. Okay, that's great, but I still want to know a little more, me personally. Others might prefer that casual approach. Me, I personally would feel a little bit brushed off. So you want to find out what communication style works best for you and go along with a doctor who you feel comfortable talking to, asking questions of, and getting answers from. Okay, so those are just a few different tips. If you have any other tips, please leave them below in the comments, especially if you've had more than one provider or had multiple babies. That's my baby calling me now, so I gotta go. All right, talk to you guys later. Bye.